in the chat. We have someone monitoring that for us. And we may ask that if you're not speaking, if we can minimize the camera time, because we've noticed sometimes with a large audience, we have some bandwidth issues with Teams. But after those housekeeping reminders, I'm gonna get the show started. Not going to spend too much time on this slide. We wanted to include this one and the next one for anyone that wasn't able to attend our first, what we call SOR, Syphilis Outbreak Response Town Hall. This shows the 6 components of our response plan, and I'll fast forward to the next page because this gives you a little better breakdown, and there's a lot to digest here. Don't spend too much time on it. I'm going to make all these slides available to you guys as soon as this is over. But I did just kind of wanted to give you the visual, the outline of what the structure looks like. And you're going to hear from the team leads of each of these components very, very shortly. But now it is my pleasure to introduce the fearless leader of these efforts, Miss Lupita Thornton.
Good morning. And thank you, Eli, for that introduction. I'd like to say I am a co-leader. Certainly, Marlene McNeese is our head leader. Unfortunately, she's not here to attend this particular town hall meeting, but I would like to personally thank everyone for being here this morning, certainly on a Friday morning, wrapping up your week. Certainly taking time to spend an hour with us is much appreciated. I also like to thank all of the medical providers, our neighboring health departments, our community-based organizations, and other organizations in our community that have already joined us in the response of the outbreak for syphilis. I'd like to thank them, and I'm hoping at the end of this town hall meeting, there'll be others who will want to join us or who can actually join us. I know you guys being here shows us the effort that you are interested and can, and I know not everyone can assist, but if you can assist with the response, certainly are welcome. Email myself. We certainly can put my email address and my phone number in the chat. And if that's something that you can and interested in doing, please do so. It really does take the entire community, whether it be, and as you can see on this slide, it takes everyone to actually respond. We definitely know there's an increase of syphilis in our community, and not only in adults, we also are seeing it in the unborn babies of women of childbearing capacity. We certainly do not want to see one child or one infant or one fetus not make it, not be born healthy into this world. So certainly very concerned about that. So any help that you guys can offer, absolutely welcome. I don't want to take too much time because we do have a tight agenda, and certainly we will have time for questions. So I am just going to go ahead and introduce Chelsea Fran. She's a policy and evaluation manager, and she's going to talk a little bit about our data, our hotspots in our community. And again, thank you all for joining us. Chelsea.
Hi, good morning, everyone. As Lupita mentioned, my name is Chelsea Friend, and I manage our policy and evaluation unit here within the Bureau of HIV, STD, and viral hepatitis at the health department. This first map shows all stages of syphilis. So that's primary, secondary, early, and late latent. The kind of yellow, the more yellow or reddish the color means the higher the density. And so we're able to see that there are a couple of like pretty high hotspots looking at data from 2022 to 2023 year to date. Right in this area near 77002 and 77006, we see that there's a hotspot. There's also kind of these darker red colors here, kind of near the West Park Tollway, near the zip code 77057, 81063, And then you kind of see a little bit of a darker color up north towards the North Freeway, right in this area. And then if we go south, you kind of see that 77021 area has a nice kind of darker spot. So this is looking at year 2022 to 2023 year to date combined. So if we look at the same year combined, but only looking at our male cases, you kind of see those same hot spots. So you see this yellow spot right in the center, that 006, 002, and you see this area towards the West Park Tollway, that 006, 057, 081. But you're going to be surprised once we move to the next map. Now, this is a map for females only. And you'll see that the hotspots are a little bit more like sparse. There's a yellow spot right here in this 021 area that you didn't really see, that dense when we looked at males only. You still kind of see the hot spot along the West Park Tollway. And then you also see up north that near the North Freeway. So this 06, 07, 09 is a little bit darker than what we see for males. And then there's just a lot more kind of red spots kind of scattered throughout the jurisdiction. So this just goes to show that there is kind of a huge difference when we look at this data between males and females. So based on these maps, we've tried to target a lot of our response activities in those areas. And so now I am going to turn it over to our lead for disease investigation and public health follow-up, Maria Martha.
And I believe Lupita is actually going to take this one for us.
Right. So I'll jump in. Thank you, Chelsea. And part of the health department's responsibility is providing public health follow-up. We certainly have combined a team specifically to address the syphilis outbreak response. And so we quickly mobilized a variety of staff members from the entire health department to actually, intervene or enhance our outreach to clients who have already reactive and who we need to do notification to. So just a quick recap here, that we were responding to 64,000 reactors. These are positive tests that are reported to the health department. And of those, 910 are actionable field records, meaning that we're actually going to do public health follow-up. We're going to intervene and try to intervene in those 910 clients. And so again, from the 15 surveillance staff, 19 DIS and case investigators, which include, again, a variety of employees throughout the health department, we are addressing 910 actionable field records in the field. So as you can see on this slide, you see the disease intervention specialist on the phone conducting interviews. They're in the field. They're interviewing in the field at the back of their cars. These are actual DIS who are performing their duties, drawing blood. We're able to draw the blood and take it to the lab immediately so they can stat it, so that we can respond immediately. We're assisting pregnant females. As you can see, that DIS is helping this pregnant female into the car so that we can transport her to get treatment prior to 30 days of her delivery. You see her partner also that's going, so that we can treat them at the same time and stop the spread to the mom and the infant as well. We're out again. DIS are out looking for clients that in areas that you would not think, in places that are not livable. So there is a vacant house there. And though it doesn't look livable, someone has listed that as their place of residence. So we're there looking for that particular client. So we're out, and again, a particular group specifically to respond to the outbreak. Thank you.
Thank you. And I think we've got Ms. Caitlin up next.
Good morning. My name is Kaylin Henderson, and I oversee our clinical operations of our syphilis outbreak response. So clinical operations is comprised of our health centers, our mobile unit, pharmacy services, laboratory services, HHD call center, our mobile vaccination unit, and community provider and partnerships. Our health centers and pharmacies have streamlined clinical treatment processes during this time. We have also implemented daily medication reports on Bicillin. We have expanded our treatment and administration capacity within our health centers for syphilis, which was done through an implementation of clinical training for all clinical staff. We have implemented a medication inventory process that involves keeping track of the available medications, which allows us to ensure we are meeting the treatment needs of the community. Our mobile vaccination unit and HHD call center, we have expanded our clinical operations to mobile sites, which will enhance our healthcare access and address barriers that the community may encounter. Our call center is working on conducting follow-up calls related to doxycycline adherence, and that team is currently working on 243 individuals regarding medication adherence. Our community provider partnership. This component is really a novel strategy based upon observations from cases that were reported to the team. A big part of these cases was that individuals were not being correctly diagnosed, staged, reported, or treated. So the team previously would contact and educate the providers through a call or through a packet that was sent to their office. And so the team realized that they really were not seeing the outcomes that they needed to see from this activity. Therefore, based on those findings, the team has created a syphilis packet that is distributed to all clinical providers, as well as created a provider number line. And that number line allows providers to contact them, and they are able to provide the support and answer questions that the clinicians may have. And therefore, from that, the team has met with 25 healthcare providers. They've engaged with 45 medical doctors, 17 nurse practitioners, and 23 other clinical staff. And on that provider line, they have received 132 provider calls. So this team has really been working really hard and very diligent to making sure that our community providers are educated and making sure that the outcome that we want to see from our pregnant women. Thank you.
Thank you so much, Caitlin. And this is the section that I'm co-leading, community mobilization. So our efforts here are focused on leveraging partnerships to amplify our message and reach. And to do that, we've been attending regularly scheduled meetings of our identified partners to provide updates. And to date, that's been to over 480 key community leaders. These have mainly been folks from non-service-based organizations and collaborations, and each one representing a larger community of strategic importance. In our conversations with community, we've asked not only for collateral dissemination, but also help in sharing our social media campaign, as well as the completion of the partnership survey I referenced early on. We're also delivering what we call our SOR presentation to organizations and programs, and this consists of a little Syphilis 101 and a local data snapshot. It goes a little deeper dive into what we showed you early on, and also a brief overview of our response structure and activities. We do have a handful more in the pipeline. And I mentioned our survey at the beginning. So we had one that we initially rolled out. This is a bigger, better one that we've got that I flashed earlier in the presentation, and I'll put it up again at the end. But our intention with this is to assess our community partners' needs and barriers to ramping up testing and treatment services. So from the first survey, the big takeaways or common themes were limitations around service capacity, either staffing or outreach, community awareness, and accessibility of services. So the solution to these problems is exactly what our partners in outreach and education are working to ameliorate by providing direct to community awareness and engagement campaigns, and delivering testing and treatment options in the most convenient manner straight to where they're needed most. And with that, I will hand it over to that team. Ms. Guadalupe, take it away.
Hello, good morning, everyone. This is Guadalupe Valdovinos. I, alongside my colleague Amber David, lead this response unit which is the outreach and education that is responsible for the expansion of mobile service screening activities in impacted areas. Our goal is to increase HIV and syphilis testing, referrals, treatment, and vaccinations for affected and high-risk individuals, as well as increase education for our key populations. And we've done this by developing a street canvas team for outreach in hotspot apartment complexes and other venues. So during phase one of our response, we have elicited, CBOs have been elicited to assist us by conducting the testing services. We know that these impacted communities, are not just affected by syphilis, but other communicable disease. And so our health department has adopted what syndemic approaches. And so when we go out to conduct mobile clinics out in community, not only are we offering HIV, syphilis testing, but we also offer Hep C testing, chlamydia, gonorrhea, and vaccine services. And so for every site, we collaborate again with our community-based organizations that are assisting us with conducting the testing services. Other local health departments such as Galveston and Fort Bend, our mobile vaccination unit, and a mobile operations services team, which supports us with logistics in order to expand our mobile service activities in these communities. Some of the mobile screening activities that have taken place so far have been in hotspot apartment complexes, bars, clubs, and priority zip codes. Some nonprofit organizations that serve our target audience. And these high impact communities and venues are identified by surveillance, our data services team, and as well as our case investigations. So what we do is we assess the needs of the community. We will, some of them allow us to bring in comprehensive services, like I mentioned earlier, the testing, the vaccine. Some of them, just depending on their needs, only allow education. So really we go based, like Eli mentioned earlier, we do an assessment to see what those communities need. We are also responsible for maintaining a public facing calendar with our sites. So far, we have, well, as of earlier this month, this is the data that you see on the screen. We've had a total of 25 outreach events. We've had almost 1,800 collateral that has been distributed, 56 syphilis 101 education sessions, 88 tests done, 53 tested for syphilis. When someone does come back positive, they are referred to our health centers for testing and not for testing, for treatment and follow-up. So that's where we are and what we do with outreach and education.
Thank you, Guadalupe. Oh. And this is just a little recap. I'm actually not leading this team, but working very closely with Miss Alma, who couldn't be here today. But she has been in charge of the public information and awareness. You see some pictures of the social media messaging that she's developed in partnership with our communication team. And I'm not sure if anyone from A Touch of Help, Just a Touch of Help is on, but this is exactly what we're hoping. If you guys can help us spread the word through social media, we very much appreciate that. And the other thing is we are very proud of our syphilis website. So I've got the link down there. I'll drop it in the chat as well. But we've tried to make it a one-stop shop. So we've got our collateral there. The heat maps that we showed you are there. We've got provider toolkits for both syphilis and congenital syphilis, as well as many other resources and links to like our related prenatal promise campaign. So please check that out. And as always, we are open to feedback. So if there's something else you want to see there, please let us know. We really we want it to be the hub for all things syphilis. So with that, I'll open it up to any questions.
Hi, how's everyone doing?
Hey there,
My
Kenesha.
Hey, how are you?
Doing all right. Be busy, right?
Be busy. We definitely been busy. I wanted to ask, we've been out doing apartment complexes and everything. Some are along the lines with Guadalupe, but we're having some difficulty trying to find like the hotspot areas. Is there any way possible that you guys can direct us to some of those areas?
The short answer is yes. Um, if nothing else, and Miss Guadalupe, I don't know if you want to speak to that a little bit, but I know we can definitely have a conversation about what the best strategy is and what hotspots we've got, what zip codes we're looking at prioritizing.
Okay,
Yes.
that'll be a
Yeah,
really
just
good.
to add, yeah, to what Eli was saying, we can provide you with a list of apartment complexes, priority zip codes. So what pretty much what data services is sharing with us, we can share some of that with you guys so that you can go out to them. We also have, I'll share a package that I have when I go out to these sites that I share with them so that you guys can have or mirror something similar to it.
Okay, great.
And thank you. I know Guadalupe has told us what amazing partners you've been in this, so thank you for that.
Oh, you're welcome. Thank you for having us.
Hello, this is Gilbert with Spring Branch Community Health Center.
Hey there, Gilbert.
All this information, it is going to be emailed to us, or do we have to send you an email to confirm to be on your
No, sir,
mailing list?
I'll make sure we get it to everyone that's on the list today.
Okay, thank you.
But please, if there's anything else you need, I think you've got my email now. Don't hesitate. If I don't know the answer, I'll get you to the right person.
All right, thanks.
Any other questions? Miss
Uh,
Ariana, I don't know if we have any in the chat.
is there going to
There
be
are,
a third session?
Yes, sir. We're looking at, it'll probably be November, but we are looking to keep these town halls as a regular occurrence.
All right, thank you.
there is discussion in the chat for the request of the zip codes and apartment complex resource Guadalupe was mentioning being provided to all CBOs. We have Civic Heart and St. Hope Foundation.
Awesome. Okay. And we can for sure follow up there. And again, those heat maps are available on the web to give you an idea, but I also know just from working with them myself, you can't always tell where the boundaries lie. So we'll make sure to get everyone clued in. Any other questions before I turn it over to the very generous folks? Oh, we got one more. Demetrio, I believe.
Yes, this is Demetrio with the Civic Card. I had a question if you could speak a little bit on, I did the survey and there was a question about the medication transfer program. Are you able to speak on it a little bit?
I'd probably turn that one over to Kaylin, but I do know, so in the survey kind of built in, we have 2 of the 3 prerequisites listed. You got to be able to store it. You got to be able to have someone on staff that's able to deliver it. The 3rd prerequisite is one that it's hard to ask in general, but you do have to have a person that is positive for syphilis. So Kaylin, please,
So-
if I missed any there, or Lupita.
Yeah, so let me add to what you've just responded to, Eli. So what we do is we are looking to see, first of all, are you testing for syphilis? Have you tested? How many of your clients that you've tested for syphilis are positive? How many are new diagnosis? We certainly, do not have as much penicillin as we'd like to offer. We certainly will provide a penicillin transfer if it's a pregnant female who's diagnosed with a new case of syphilis. But in general, we're looking to see, first of all, are you testing? The people in your community are infected? If they are, then who's pregnant, and then we'll provide that Bicillin. Also, if you serve a homeless population, we certainly know that it's hard for homeless population to adhere to the doxycycline. We all know that this is a syphilis response to doxy and have limited Bicillin. So those are some criterias. Also, if someone, Eli, if someone can post the 855 number on the chat, that's the number that you can call to request medication transfer. And then from there, there'll be a series of questions and observation, and then at some point approval for the transfer of the medication.
Okay, thank you.
You're welcome.
And yes, I'll get that dropped in there, Lupita, along with the website. But if we have no further syphilis specific questions about our response, I'm going to turn it over to the wonderful Lindsay Lanigan and Jill Johns from Legacy. And I have asked them to do just a little bit on testing and reporting practices or policies rather in Texas. We've got a little general overview, but that's not where we're going to put most of the focus. So with that, I will turn it over to these lovely individuals. And thank y'all again for doing this.
Thank you so much. I'm going to go ahead and kick us off. Hello, everyone. I'm Jill Johns, and today we're going to be talking about the testing and reporting policies. So for this first slide, there are different reporting requirements depending on the communicable disease that's being reported. So if it's a case of acute HIV or primary or secondary syphilis, then local reporting has to be done within 1 day via phone call. And our reporting authorities are the county in which you're living. So if you're in Houston, it's Harris County, and the reporting authority phone number is here on the slide. And then for Brazoria, Chambers, and Galveston, there's a separate reporting number also on the slide. So for those specific instances, acute HIV or primary secondary syphilis, in addition to a phone call, a form must be completed within a week, within 7 calendar days. And that form is available on the disease reporting site for Houston Health Department. And the form is called the ACRF. That specific one is for HIV. And then there is a separate one for other communicable sexually transmitted diseases and infections. So If it is non-acute HIV or non-primary, non-secondary syphilis, also if it's chlamydia, gonorrhea, or chancroid, then you don't need to do a phone call for those. Simply filling out the form will do. As I mentioned, it's a separate form. And it must also be completed within 7 calendar days. If you are reporting for hepatitis C, an acute case of hep C, then there's not a form for that piece. It's just a phone call to the number there on this slide. And as with the others, it must be done within 1 week of discovering. So related to that, when we're talking about reporting, there are policies written into the health code and other parts of the Texas codes. So the first one mentioned the general laws. Those codes are related to mandatory reporting. So it lays out what's considered a reportable disease, communicable diseases, and how and why those must be reported. So we wanted to cover that. The second one, minors and consent, is in relation to minors consenting to services. So in the state of Texas, if someone were to meet a certain set of guidelines and they're a minor, then they're able to consent to certain services for medical, dental, and psychological reasons. So some of these reasons include if the person is emancipated and they're 16 years or older, if they are married and they're still a minor, if they're on active duty for military, but then there's also a carve out for someone who's seeking specific kinds of services. And one of those services is treatment and diagnosis of a reportable infectious, contagious, or communicable disease. So that means if someone is a minor and they're seeking out the detection or treatment for an STI, then they do not need the consent of a parent. And so that's just a good piece of information to have. So even though someone is able to consent to treatment, that doesn't necessarily mean that a CPS report is not needed or warranted. So for the state of Texas, the age of consent is 17 years old. So if someone is 17 or older, then they are considered able to consent. And if you're giving services to someone 17 and up, then a Child Protective Services report would not need to be filed. On the flip side, if someone is 13 years or under, then there is no affirmative defense or no situation where a CPS report would not be filed. So if a 13 or under person comes in seeking services and they are engaging in sexual activity, then the report has to be filed. And these Child Protective Services reports must be filed within 48 hours of discovering the incident. So that does leave a gap for people who are ages 14, 15, and 16. And so for this group, there is an option of affirmative defense. So just for the people who are in those 3 ages. And affirmative defense is also called the Romeo and Juliet law. And it applies only to people who are 14, 15, 16. And the age of their partner must be within 3 years of that person's age. So it could be a 16-year-old whose partner is 19, a 15-year-old with an 18-year-old partner, or a 14-year-old with a 17-year-old partner. In addition, according to the law, the partner must also be the opposite sex of the minor. The partner must not be a sex offender. The sexual activity is consensual. That's a critical part of this. The partner is not biologically or legally related to the minor. And the minor, another part of affirmative defense is the minor is legally married to the partner. So if the minor is legally married to the partner, that does count as affirmative defense if they fall within ages 14 to 16. And then those other ones apply as well. So for affirmative defense, the clear takeaways are that the ages are very important. And then the statute does specifically say that the two partners must be of the opposite sex. So the CPS report would be filed if sexual activity is being engaged in with two minor children if they are of the same sex. So I'm going to go ahead and let Lindsay take it on next.
Sure. And I know that, our goal across the city of Houston is really to promote testing. And so sometimes I think organizations get a little bit concerned when we talk about testing for HIV or any STD in minors, because a lot of our grants revolve around asking questions about sexual history. So I just want to provide sort of how Legacy handles those situations, so that we don't end up in a situation where we're having to constantly report. And Jill, you can correct me if I'm wrong, but essentially you can let the minor know if they're in those ages is it 14 to 16?
Yes,
14 to 16.
Mm-hmm.
That they don't have to answer the question at all. We can absolutely say, it's your choice in order to answer this question. If you're asking about sexual history for those individuals, the importance in all of this, and when we come to public health, is that we're testing. Period. It's not necessarily that we're collecting data on their sexual histories, and so I just want to encourage folks to keep up with testing for minors, because there are ways that we can test minors and that they don't have to consent to essentially reporting their sexual history. So that doesn't put you in a bad position. It doesn't put the person that's being tested in a bad position. The ultimate goal is that we just get individuals tested so that we end this epidemic. So I will, I think the next slide is just to cover briefly some of the things that we're doing around HIV policy in the state of Texas. We had a great last legislative session. We made strides that we haven't made before. We had our HIV Day at the Capitol, so we invite everyone on this call to please join us. That is going to be done every single legislative session during the regular session. So from January to May 31st on every odd year is essentially when we host those days. This one was done on March 27th. We partnered with the Positive Women's Network, with Prism Health in Dallas, and then Legacy Community Health as well. We had over 100 people attend, and we had a ton of legislative visits. And if we go to the next slide, I'll tell you the main focus of what we were trying to do. We actually had a lot of movement this year by passing two bills out of the House, which we had never passed a testing bill before. One of the bills and the most successful bill that I see moving in the future is really adding an HIV test to an STD panel. If you can believe it, that's not a standard practice. It's not required that you have the HIV test within the STD panel. And we all know as public health professionals that if you have people coming in multiple times for an STD, that they are very much at risk for contracting the disease. So we are adamant that this be included as part of the STD panel. That passed the House with flying colors. As you can see the board here, the green means good to go. The red is people that voted against it. We haven't seen an HIV bill ever hit the House floor in a very, very long time. So exciting that happened. Now it did die in the Senate, so we have a lot of work to do in the Senate. As any healthcare professional will tell you, there's a lot of work to do in the Senate regardless. The other bill that we worked on was adding an HIV test to your routine medical screening or your once a year physical. That bill also passed the House. It had a little bit less favorable vote, but it still passed with flying colors. And then we advocated for adding injectables to the Texas HIV medication code, and we executed that. We're still working a little bit on who's going to pay for it, whether it's the federal government or the state. So we're seeing that through. But we fully funded the AIDS drug assistance program as well as all prevention and treatment efforts at the state legislative session. So again, I think testing is #1 priority for all of us. If people do not know their status, they are not going to be able to seek treatment and also prevention. So it's a great way to talk to people about prevention as well if they're coming in for a test. We all know that. I'm preaching to the choir here. But if there's any other slides that I need to cover, I don't think there are. But please know, Mary Gonzalez, she is a representative in the State House. She is very committed to repealing the harmful provision around the Romeo and Juliet law. And she filed a bill this year. It was heard in committee. It's been heard in committee in the past. It's a constant thing that the legislature hears about, as well as repealing the sodomy law. These are things that are extremely important to our communities, and it's something that we're going to keep at the front of legislators' minds. So I will say that this is a long haul. This has been a very interesting last 10 years in the Texas legislature, as I'm sure you've read about. It keeps getting more and more conservative, but these are things that are just common sense when it comes to sodomy, as well as the Romeo and Juliet law prohibiting same-sex partnerships in those age groups. So happy to answer any questions, but please don't let the Romeo and Juliet law be the reason that you are not testing. There are absolute ways that we can still test and make sure people know their status so that the disease isn't transmitted. So again, happy to answer any questions, and thank you all for this opportunity.
Well, and thank y'all again so much for doing this. And I'm just impressed that you've done 10 years at the Texas legislature. I'm still recovering from my one.
I've done 18.
Oh my goodness.
I'm so tired. Yes.
Oh my goodness.
It's getting worse and worse. So
yeah.
But better and better. It was a very strange situation because we have, the first individual living with HIV, Black gay man that is a legislator now. So that has completely changed the game when it comes to HIV policy. And then we had Tom Oliverson, who is the very person that carried the ban on trans care bill, sign on as a co-author with Vinton Jones to move this bill forward. So very strange legislative session, but there are always opportunities for HIV policy within the legislature, no matter how conservative it gets.
We appreciate not just your help today, but your work there, and those were certainly some wins.
Mm-hmm. Thank you so much, Elliot. Appreciate it.
Oh, and please, guys, I'm gonna hush up now, I promise, and open it up for questions.
A shy group, I see. Okay.
Well, you may just have done such a wonderful job that we didn't leave any room for curiosity.
No, I just want to add that thank you for presentation. It's very informative. I'm just concerned about how conservative Texas has become and how they're cutting back on like HIV services and stuff like that. So, but thank you for your presentation for both of you. Thanks.
No, Gilbert, you're absolutely correct. What I will say though is they have, in the past, when we were in the midst of COVID, they absolutely proposed some cuts to the Texas HIV medication program. And the outcry around that was so impactful that they ended up not cutting anything. And we fully funded this legislative session, the THMP, as well as prevention and treatment. So I completely understand that it may seem that those services would be cut just because of the nature of the legislative session. But at the same time, that's not actually what we're seeing on the ground. Because because this community is so active, because all of you on this call are so active in reaching out to your legislators, we've actually staved off so many detrimental things that would happen to this program. In fact, they've improved the program in a lot of ways. And I was actually speaking at an event last night to ANAC, which is an association of nurses that do HIV and AIDS care. And it was so impressive to see that group so engaged, and that's really what moves the needle. We did talk a lot about just the website in general of THMP and how to sign up for the program. They have gone from, a waiting list of over 2,000 people, 6 months, to, as it's been reported to me, 0 waiting list. Now, that doesn't mean everything's perfect, but it does mean that they are making strides to improve that program. So I'm the eternal optimist, even though I've been doing this for way, way, way too long. I am the eternal optimist when it comes to communities that can absolutely change the game. And the HIV community is a community that can do that.
All right, thank you.
Thank you, Lindsay and Jill. We're going to open it up for any other questions that you all might have in reference to the entire town hall meeting. We'll take a few of those before we wrap it up. What questions do you have of us? Okay, wonderful. Again, I encourage those who are able to participate with us in responding to this outbreak. Please reach out to me. You have my name and email and phone number in the chat, and that 855 number if you're reporting, or if you're interested in receiving medication transfer, please reach out and let's see how we can make that work for you.
And
Eli,
Lupita,
is there any last
yeah,
minute?
I was going to do 3 quick announcements just to tease a few events we've got coming up.
Absolutely.
Our very popular Sharing Science Symposium is going to be November 30th this year. And I've got the registration link on these slides, and I'm going to drop it in the chat as soon as I get through all 3 of these. We've also got an event coming up with our hepatitis task force on the 18th, and I'll drop that one in as well. And that's going to be the treatment of Hep C in the scope of primary care with, if you recognize that figure there, that's Dr. Kadiri of Project Echo, and she is a legend. And we also are working on our hepatitis elimination planning. So that'll be kicking off if you're interested in participating. Again, it'll be in the slides, and I'll drop that. And then lastly, we've got a save the date for one of our partner programs here at the health department. To Access and Equity Partner Symposium. That's going to be on November 8th. And that is all I have. I'm going to make good on my promise in the chat. Thank you all again. And Lupita, I don't know if you wanted to have the final word.
Just thanking everybody again, and we look forward to seeing and speaking with you guys. When's our next town hall again, Eli?
We're looking at November, and I'll have to look at what date but we'll get word out there.
Great, excellent. And please bring your partners, folks that you collaborate with as well. We'd be happy to have them on as well. So again, thank you, and have a wonderful weekend, and be safe.
Thanks, yeah.
Thank you.
Thank you. Have a good weekend.